So the next one which we are going to talk is known as Osterine, or else there is a number called MK2866, or else in the market it will be known as ENDORSEMENT. So this is actually not a SARM, but it is a SARM-like. So the difference is it's actually acts on the androgenic receptors. So you have the testosterone hormone which acts on the testosterone androgenic receptors. So Osterine 2 acts on the androgenic receptors. So this was actually developed by the GTX company to treat the prevention of muscle wasting and osteoporosis. So what happens here is, if you take our human body, we have an axis called the human pituitary axis. So where we call as the hypothalamic pituitary axis. So if you take anabolic steroids, it will have an effect of nearly 90 to 95% of affecting the axis, but Osterine with reduced side effects of affecting the axis of 10 to 20%. But this Osterine has been banned by the World Anti-Doping Agency in 2008. But if you take muscle, actually it activates the muscle stem cells and it increases the muscle mass, the muscle strength, and it increases the regeneration as well. It stimulates the connective tissue, so it helps in activating of the repairs of the muscles and muscle fibers, and it increases the insulin-like growth factors. So there will be a muscle growth as well as the strength as well. So as I mentioned earlier, as it was used to treat the osteoporosis, this will help in bone density and bone mineralization, and pathetically, it will increase the blood estrogen levels and will reduce the testosterone levels. So if you take the side effects, mostly this can present as headache, back pain, and you might feel lethargy after start taking Osterine because it reduces the testosterone levels. But if you take more than what is recommended, you will develop something called gynecomastia, the male boobs, if you take more than 20 to 30 milligrams per day. What happens here is the testosterone will be converted to the estrogen by the aromatase enzyme. But if you really develop gynecomastia, you can go to aromatase inhibitors. Sometimes you can develop testicular pain, you will feel reduced strength, depression, acne, and you will have hair loss and baldness as well. So if you take the dosage, actually Osterine for a beginner should be around 10 to 20 milligrams per day for like 6 weeks on a consistent time. But if you are an advanced person, you can go to 20 to 30 milligrams per day for 12 weeks. But here, post-cycle therapy is must.